What is oral health? The state of being free from mouth and, that is throat, facial pain, infections, oral sores, and diseases.
Celebrated by the Dental Department of the Federal Medical Center Ovwian is very, very sacrosanct to us because we've been having surge of oral disorders, which I think the experts are going to do justice to it.
World Oral Health Day is celebrated every year on 20th of March. So the purpose of World Oral Health Day is to increase awareness and knowledge, and also this will also enhance the positive attitude and the right behavior to oral health, which is very important. So the theme of World Oral Health Day 2026 is a happy mouth is a happy life. So what this exercise is that the oral health, there's a link, there's a connection between the oral health and the general health, which is also very important. And also to increase the prevention of oral health disease. So the importance of for prevention of oral health disease, which is also very important. Different oral disease. The primary factors is taking of sugary food or drinks that causes oral disease. So I also have limited dental visits. So because of a lot of people don't care about the oral health, so there is a limited dental visit. Then also lack of awareness, as I said earlier, and knowledge and education about oral health. So this can also be one of the causes of oral disease in Nigeria. Then the importance practice how to keep good oral hygiene. One of the importance of it is food brushing. So food brushing is not just food brushing; it has different components. The frequency is also very important. The frequency that you have to brush twice a day. Twice a day is that in the morning after breakfast, then at night, the last thing before you go to bed. I'm not just brushing. We have the soft, we have the hard, we have the medium, we have the hard to brush. Soft is the primary teeth. Then for the medium, it's for adult. The one for hard is for those that are like smokers and those that are on prosthetic dental material, like those on braces. So we encourage them to use hard brush. But as an adult, the best brush is medium pistol brush. That is the specific brush for dental clinic. Like every 6 months, that is twice a year. So this is also very important, so that in case there is a dental condition, so that can be detected earlier, and more the earlier, the more easy for it to be managed.
The most common technique of brushing is called the modified bars technique, in which, first of all, before you start brushing, you get a medium tooth bristle brush for adults. So for adults, use a medium tooth bristle brush, meaning your brush, the tip of your brush, the bristle, not too soft and not too hard. So you hold your brush 45-degree angle and start with the upper teeth, also known as the maxillary teeth. Hold your toothbrush. You divide your mouth into quadrants, meaning you divide your mouth into 4 parts. This is the middle part of your mouth, which is your incisors. So you hold your brush 45-degree angle and you start. 3 to 8 strokes. Make sure your hands are turning. You start from the gum line. 3 to 8 strokes. 3 to 8 strokes. When you move from there, you go to the next part. Go to the other part. Then you go to the back part of your teeth. You do the same thing. as if you are sweeping the mouth down. So we do not brush like this. This is the wrong pattern of brushing. If you brush like this, you are pushing the dirt to the back of your mouth and you are receding your gum line. So position your brush 45-degree angle and you take it gently down 3 to 8 strokes. So when you are through from the front part, you go to the back part and you do the same thing 3 to 8 strokes. And when you come to this part, of your anterior teeth, you do it like this. This for your, and when you are through, make sure you brush these surfaces. When you are through with the up, you come to the down. 3 to 8 strokes. And inside of the teeth. Now for children, we use the circular or the front method of brushing. For mothers, they are the ones that brush for you because they do not know how to brush. As they get older, you now start teaching them how to brush. If they are insisting that I want to brush on my own, you can allow them, then you will brush their teeth. With the same 2 minutes. But this time, now children do not have complete speech, so you cannot divide their mouth into four, divide it into subtimes. You go like this. Like in form of circles. Like you are making circles. Brush it gently so that you do not injure their gum. When you are through with the outer surface, you now go to the inner surface. You brush their chewy surfaces, then you gently brush back, making circles with the toothbrush. Same thing here. So I'm making circles, that's why we call it circular motion. So, brushing. That is for children inside the teeth. So you do not just put it with force. Gently do it so that you do not injure your gum. Slide it inside and you take it back and front. Back and front. So it's not only when something is stuck in your mouth that you brush it. I advise that you brush your teeth every day. And you do that before brushing. Meaning after you finish eating, that's when you do it. When you brush. When you brush, after brushing your mouth, you spit out thorough.
Dental checkup, as I said earlier, is also very important too, because the teeth brushing cannot remove all the deposit. There's what we call plaque and calculus are firmly attached to the teeth. So you need a professional clinic for it to be removed. And plaque and calculus is the primary cause why most of these dental diseases occur in the mouth too. So that is why, like, in our dental clinic, we have all this facility on ground. If you want to do the cleaning of your teeth, we have it. Then if you want to call any dental teeth, we have it on ground. Very, very important. So it contains a lot of microorganisms, and one of the most common microorganisms is known as streptococcus mutant. You know, a lot of people will say that when you go outside, a lot of people will say that it's worm that is eating. It's not worm. It's the bacteria. The bacteria produces acid that take the tooth. So because of the bacteria is found in the blood, so this bacteria now produce acid. So it's the acid now that decay the tooth, not worm. Also too, it's also very important. So and then so many things can occur from this dental caries, because if you look at the teeth has the part that we see called the crown. It has different structures. And you know what sepsis? Sepsis occur when there's a dysfunction of the organ will shut down. Definitely. To encourage good oral hygiene in children is also very important. There is a case that is called early child dependence. occur in the child less than 6 years. Two. So it can be transmitted from mother to child. That is why we don't encourage child kissing their mother, because they can transfer the organism, the microorganism that causes from the child to from the mother to their child too. So all these things are very important. Companies like after like they call them the periodontia. Periodontia is made of different structures. You have the ligament, and also the muscular. Prevention of gum disease is also very, very important. So prevention is everything just to maintain good oral hygiene, follow the normal process, and also avoid of tobacco and alcohol, because tobacco contains a lot of substance that alter the structure of the mouth. Tobacco contains carbon monoxide, tar, and other harmful substances that damage the structure of the mouth. Then also alcohol, because definitely alcohol has a solvent, all those microorganisms to add them. Also, good nutrition is also very important to help to maintain good oral health too is also very important, because when you eat food that contain a lot of vitamins like vitamin A or E, help the realization of the oral tissues is also very important. Then also regular professional dental visits. As I said earlier, because dental visit is something very important. It's the dental clinic at least every 6 months, twice there. It's also very important too. We put that here, if you want to clean your teeth, you come and put that there. And also other variety of dental visit that also do that. Then also early treatment, because when you visit the dental clinic, you're able to detect the condition earlier, and also organized by the World Dental Federation. Now, what do we do in the World Oral Health Day? We galvanize, unite the world to reduce the burden of oral health disease. And then we going to promote prevention of oral health. That takes me to that definition, the definition. What is oral health? The state of being free from mouth and, that is throat, facial pain, infections, oral sores, and diseases. That is why inherent in this WHO definition are 4 components. Component 1, fundamental. Component 2, systemic. Component 3 is the preventable, modifiable risk factors. And component 4 is inequality and access. Oral health is a key indicator to overall health. 2, it is fundamental to well-being. 3, it enables essential processes such as breathing, eating, speaking. But please, it includes smiling and the ability to express through facial gestures, facial expression. Then, oral health is impactful on the quality of life and on psychosocial health. For 2026, a happy mouth is a what? A happy life. So every year, a team is taken to capture the campaign, to raise awareness. So the ultimate goal is to equip everyone with knowledge, with tools, and with confidence to secure good oral health. Now, when I was defining word health, and I said three components. 4, and I told you the first one, isn't it? Now, second one is systemic connection. You know that oral health is intrinsically linked with overall health, such that oral health is a very key indicator of the overall health. Increase in free sugar consumption, tobacco use, alcohol use, and then the same thing. Then inequality and access. Because of urbanization, usually it has been found out and can be proven that it is the people in the lower socio-economic class or people with less education or people, because of urbanization, embrace food. And you know that food that is abundant with free sugar is everywhere because it is being marketed, and because 2, fluoride in the food we ate is decreasing. For example, before, when at our stage, when we were growing up, we will have urban water board, but now do we have it? Urban water board was fluoridated water. Common disease, or the most common disease condition in the whole world, is untreated dental caries in permanent teeth. This is the operation, and this is what it is. Because of that, in 2021, there was a resolution by the World Health Assembly, which says we should leave the approach from curative to the approach of preventive, and make oral health a part of preventive education, that family, in the school, in the health system, so that the economy, the burden of health will be reduced. So now, it is now, the word is to affordable, preventive, comprehensive, and timely care. The word, let's use the word affordable. Have you say affordable? Affordable. Have you used the word comprehensive? Have you used the word timely? Now, that is the term B that the person now come. Because of this, the dental caries that is the highest everywhere, I think before that, at 2021, it was the most common disease on earth. Untreated dental caries, a permanent dentition, global burden of disease. Then, periodontal disease, even the late stage, affects 1 billion people. Or due to trauma, water sport, unsafe playground, like I said, we should not take education to the schools. And what about children unsupervised during their playground? You meet your PTA meetings, tell your teachers, every time children are playing, a teacher must stand on guard. A teacher must stand on guard because it's important. Your toothbrush must be changed in 3 months. It's actually 2 months and 3 weeks as the shelf life of toothbrush. But because we do not want that, I say 3 months. Look, balanced diet, food must be reduced in free sugar, rich in protein, rich in vitamins, fruit, and vegetables, and the main liquid should be water. The truth is that if you actually brush truly once a day, you can keep plaque off. But it is recommended to brush twice a day. Why do you brush last thing at night? Because at night, salivary flow is decreased. And everything in your mouth having been that will not removed by brushing will not cause what? Decay. If you must not eat between meal. Any snack in between meal build up the plaque. And let me tell you this. There's what we call 5.5 pH of the mouth. Critical pH is 5.5. If your mouth pH at 5.5, once it gets to 5.5, calcium is removed. So once it decreases, more calcium is removed. So there is decalcification. That is the removal of calcium. Little holes be formed in your mouth every time you take your, is it juice? Is it mineral? Every time you take it, because the pH drops. And when you rinse with water, you will minimize hypersensitivity. And when you look at the structure of the teeth or tooth, the tooth have an outer coverage, which is called the enamel, on the corner aspect of the tooth. So on the root aspect, you have what we call the cementing. So when the outer part is lost, like terms of the enamel, so it exposes the teeth. So the dentin is the inner layer, and the dentin has a microtubule that connects the inner part of the tooth. So that dentin also called the dentinal fluid. There's a fluid there that conducts stimulus, either cold or hot, to the inner part of the tooth that has nerves ending. So that is what will happen when there is loss of the outer part of the tooth, the enamel. That is what I call shock when you take cold water. When there is loss of the outer part of the protective layer of the tooth, exposing the middle layer that has a microtube. So there's a treatment for that. When you come to the clinic, when you come to our clinic, there are different methods in which we can treat that aspect of it. So that condition is known as dentin hypersensitivity. It's just water and there is shock, either cold or hot. There is a problem. There ought not to be any shock. Come to the clinic for these cases. Also, there are risk factors when it comes to decay in children. Most times, children don't allow their parents to brush their teeth, and that is a difficult problem too. And most times, children take more of sweet things, and also most of them a pacifier, and also breastfeeding others, or this pacifier that they put in the mouth allied that children. So the primary cause is sugary food or drinks, and also poor oral that lead to plaque of the. So that is just it. You allow your child to sleep on the feeding bottle. Feeding bottle. Don't. No use of sweetened comforter. If you may use comforter, it may be ordinary water. Now, please, older people were not eating sugar as we used to eat. Please don't forget that. And when they are using the chew stick, they chew it and chew it to tough and chew it and keep it in the mouth. And then there are even antibacterial in that chew stick.
Knowledge deposited was well received, and I'm so impressed. My own contribution to this is to the general public and all of us together. You notice that FMC Ovwian, we are not just delivering service, we are delivering quality service with specialists involved. So it shows that our specialists are not just coming to tell you what is obsolete, it is what is ongoing.
recent event, for example, for you to know, because this is just one of the media presentation. There will be more specialists presenting. FMCOI is here to give you specialist care. It's equivalent to a tertiary hospital. There's so more specialists to come, like innovation from the medical aspect and others. There's the oncology, public health, you guys were not there when Dr. Rita and Dr. Henry did their presentation on infection prevention. It was mind blowing. So we want the people of this environment to benefit from specialist care. It is just because the tip of the iceberg. If it was not going to be the standard presentation, we would have seen what they call evidence-based research, and that's where we're going to get to. I'm so impressed, and I thank everybody for coming out to attend. God bless you, God bless you, God bless you.